Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Transference and the countertransference. So transference and countertransference, first is they are the phenomena. So they are the phenomena that occurs during the psychoanalysis, as well as sometimes in the ordinary physician. So or the patient relation. So physician as well as the patient relationship. So now let's look at the transference. So under transference, it is the unconscious re-experiencing of feeling. So it is the unconscious re-experiencing of the feelings, and this is about the parents or the important life figures, and this is in the patient's life in his current relationship. Now looking at the counter transference. The counter transference, you have the unconscious. So unconscious re-experiencing, and this is of the feelings. So transference is unconscious re-experiencing of the feelings about the parents of or important life figures in patient's life in his current relationship. So counter transference is the unconscious re-experiencing of the feelings of the parents or important life figures in the therapist's life. This is the therapist's life. So counter transference is therapist's life, and transference, it is the patient's life, therapist's life in his current relationship. To learn and grow daily like this, please do subscribe.